So, Paul, we have trouble diagnosing these patients early enough. What are some of the obstacles that we have to overcome in order to do a better job?
Yeah, you're exactly right. I think there's probably, four broad obstacles that are playing a significant role. One is, the patient themselves. I think some are coming in very quickly and recognizing things, but there's a lot who are not, or not noticing the subtle changes with current technologies. The doctors, I think there's a study by Neely that showed very clearly that 25% of the patients that presented to a clinical study were not diagnosed with AMD, and yet they had it. And 1/3 of those were intermediate stage. It's also, the Amsler grid testing of today. How do you monitor the sensitivity? And then it's the follow-up frequency that currently exists in most of our systems or plans for patients.
Yeah, I want to hit on two particular areas. The first of all is that follow-up frequency. These patients in their 60s, 70s, and 80s, they have a lot of doctor's appointments for both themselves and hopefully their spouse at the same time. And so that follow-up frequency is really, really difficult on patients. And if they're not seeing that they're having any problems, they tend to defer some of those visits. And I think it's too easy for those patients to just kind of fall through the cracks, not get follow-up calls, not come back for their visits. And the second is the Amsler grid. As far as we've come in ophthalmology and in retina, optometry, as far as the technologies we use, absolutely amazing. Yet we're still using a test that is decades old, that has limited sensitivity, and is frankly difficult for patients to be able to use and monitor their vision.
It is true. I've seen, even in my own clinic, trying to teach patients how to use the Amsler grid, and they come back and say, now where was I supposed to look? And the other thing is that you said it doesn't have the sensitivity, and I worry that it gives a lot of patients a false sense of security, feeling like, well, I think I'm doing okay, I can't tell anything's wrong, I'm okay to stay here. And I think that plays into the frequency of follow-up that you discussed as well. So I think those are categories.